Now, please welcome to the podium Rotary Past President Karen Hung, founder and CEO of Silver Rock Consulting, to introduce today's speaker. Karen?
Hello, everyone. Happy noon. And, because people talk about good morning, good afternoon, but it's really good noon. All right. As I introduce our keynote speaker, I just want to start off with a question for you to ponder. What is something we all want and need and may not think about it every moment until it impacts us or a loved one? Our health. That's right. Thank you. So today we have an opportunity to learn more about one of our healthcare systems that enables us with our health and our wellness. I have the distinct pleasure of introducing Daniel Jackson, CEO of Ascension Wisconsin, to you again today. Daniel joined our club earlier this year, and today he is our featured keynote speaker. Daniel joined Ascension Wisconsin, that is focused on compassionate care, in March of 2023. So you've hit your one-year mark. As the interim president of Columbia St. Mary's Milwaukee campus, and then was named Ministry Market CEO in August of 2023. Previously, Daniel served as CEO of the Detroit Medical Center, Sinai Grace Hospital, part of Tenet Healthcare, and it was the largest of eight hospitals that comprise the Detroit Medical Center. And I don't know if you all are familiar with how hospitals and healthcare systems run, but there's a ton of complexity that goes into just day-to-day operations as well as the long-term view. Daniel served earlier in senior leadership positions at hospitals in Texas, Virginia, Florida, and Georgia. So he's moved around a bit, seen a few different healthcare systems, and each state actually has its own characteristics. Daniel holds a Master's of Science in Public Health Administration from Meharry Medical College in Nashville and a Bachelor of Science in Biology from Morehouse College in Atlanta. So Charles, you're headed to Morehouse. It's a little shout out here with an alum here in the house. On a personal note, as an Ascension Wisconsin board director, I have found Daniel to be insightful, determined, and driven to deliver excellence to all of us in the system with their team across their state. So please join me in welcoming Daniel to the stage. Daniel?
Good afternoon. Can you hear me okay? I have been accused on several occasions of being soft-spoken, so if you just give me a sign, I'll speak louder. It's my distinct pleasure to be with you this afternoon. As you said, I'm Daniel Jackson. I'm the president of the Wisconsin Ascension Market. I've been in healthcare for about 27 years, and it's been a wonderful, meaningful experience. Happy to be here with you today, and I'm going to give you an overview of the healthcare system and our presence here in Wisconsin. I think it's appropriate to start from a historical perspective. Ascension was formed out of I'll call it the merger, if you will, of four distinct health systems that were operating here in the state of Wisconsin. That was Wheaton Franciscan, Ministry Health, Affinity Health, and Wheaton Franciscan Healthcare System. Needless to say, the market was fragile, but very necessary. In my time here, I've heard different iterations of the how and the why, and I would offer to you that does it matter? How many people wake up in the morning wanting to go to the hospital? Any hands? I typically say, unless you're having a baby or some type of nip or tuck, you're probably a reluctant participant, right? It's not the thing that you want to have happen. So in this environment, how do you get however many associates that you have to be on the same page about making sure that person who showed up at your door as a reluctant participant, probably scared, hurting, and not knowing what to do. In their moment of need, how do you get a system of people to put them at the center of being there? Also, I'm accustomed to saying, when I'm in a room by myself, the theory of healthcare works perfectly. It will go as planned. The moment we introduce one other being, it changes exponentially. Because people show up with their lives, the things that are going on with them, and how many of those things should matter to the patient? Not one. So it's not an unreasonable expectation that a healthcare system put you at the center of what they do and how they do it, and that you feel that. And that's part of our goal, mission, and aim for Ascension Wisconsin. So at a high level, I'm going to walk you through how do we make this very difficult thing a little bit more simple and consistent. That is the goal. And you'll hear a common theme that I share with my team all the time, that we are blessed to do the hard work. By no means is it easy, but that's our purpose and that we want to lean into it. When you think about a community and what makes that up, there are a couple pillars that are consistent. We want strong schools. We want strong businesses. We want a church, a place of worship, and we want healthcare. So that our intrinsic needs, basic needs, are met. And when you think about that, you take that out to a hospital. The thought of getting up and saying, we want to make it happen, we want to put you at the center. And when you introduce that other person, and then the complexities start to show up. A hospital is like a city. Everything imaginable takes place there. You have a physical plan. You have marketing. You have to think about policy. You have human resources. You have to think about strategic planning. You have to have a supply chain to get the services or the supplies that you need at the right place. You have scheduling. All of these things take place for the coordinated care for one person. And what time do hospitals close? They don't. So the thought of 24/7 that you're making this operation work and pulling those levers to make it work in a positive way consistently is a daunting task. For us, we have 17 hospitals here in Wisconsin and about 11,000 employees. And we work hard every day to make sure each of those hospitals operates well and efficiently, but also, more importantly, each of those 11,000 associates understand that the company is committed to them being put in the best position to take care of you in that moment of need. As I said before, it can be difficult, but we try to find a way to make it happen. Particularly here in Wisconsin and across our mission of Ascension, we've committed ourselves to taking care of the less fortunate and those underserved. That is our primary goal. We serve as a safety net facility, both here in Wisconsin and other communities as well. One of the things about healthcare is very well documented. I don't know if it's the only, but it's one of the few businesses where you have to be transparent about your costs, what it costs to take care of a patient. And when you tabulate that, let's say the cost is $1, then payers and the government says, well, it costs you $1, we're going to pay you 67 cents. And your job is to figure out how to keep it going. Do you think that would add any complexity? Not many other industries have to deal with that. And when you talk about the regulatory environment in which we operate, again, it adds complexity to that. But that's not a barrier. We figure out how. I'm the father of 2 boys, teenage boys, one's 17, one's 14. And I share with them often that just because it's hard doesn't mean that we don't do it, right? So being committed to that mission, being committed to that patient, of that person who's the reluctant participant in that moment of need, that they can trust that people will put them at the center of their care. That's our commitment. What does that look like in terms of micro challenges across our landscape? We have a population that's aging. We have more people that need more intense care. juxtapose more people who have opted out of the work environment. During the height of COVID, about 40% of the workforce opted out, whether it was fear, early retirement, or no longer wanting to be put at risk in that environment, and not in a temporary fashion, but permanently. They didn't come back. So how do we come up with ways to create a value proposition to replenish that workforce, and have people be in a position to take care of those in a time of need? We've talked about a little bit about the financial landscape and challenges associated with providing care. If you work in this environment, not many associates would say, understanding the financial challenges of an organization, that as an individual employer and a caretaker of their family, would it be acceptable for them not to get a raise? Would it be acceptable for them not to have a path of growth? Again, all these complexities come into play. The number of issues in terms of being able to keep up with technology, whether it be AI or just advancements in healthcare. How do we afford those things? How do we make those things accessible to those who may be less fortunate? Again, adding to the complexity of this equation that we have chosen to participate and help to resolve. Cyber attacks in this world of evolving things. We had a pretty significant cyber attack on the 8th of May. Brings everything to a halt. When you think about one of the salient points there, 60% of our nurses had never charted on paper. All they had known was a computer. How many of us would that be a challenge if we had to release ourselves from our phone? I heard somebody say, wow. The hard thing. So in the midst of care, when the manner in which you do that is disrupted, can you be nimble enough? Can you accommodate the circumstances enough to continue to care for patients? Again, that reluctant participant, do you think they matter? Does it matter to them if you can chart on paper or not? It doesn't. And I'm not offering that it should. But for the people that are the caregivers, you have to walk through that hurdle. You have to figure it out. Because what time do we close? We don't. And so continually, day after day, I'm building up the resilience to work through these challenges, but being committed to the community in which we serve. We also have a very focused intent on trying to lessen the impact of social determinants of health. There is evidence-based medicine that suggests that the stressors of life can be disproportionate in terms of how they manifest themselves on people at risk or at-risk communities. So how do we learn from those things and better the quality of life in communities? Have a positive impact so that others can thrive in spite of those circumstances. We spend a lot of time in that space. Despite the financial challenges, being consistent in our philanthropic work to make sure that the research or just normal care are provided to those that are most vulnerable. Again, coming back to our mission as an organization and making sure that we manifest that in every way possible. But then also, more importantly, for our associates aligned with us, that they see the evidence of that in every decision we make as an employer. That compassion is not only extended to the community, but those that help us live our mission as well. It's important for all of us. Some of the programs that we have in Ascension, specifically here in the Milwaukee area, one is the Blankets of Love. These are for at-risk mothers where they receive care to help them as they become new mothers and care for their children. We see about 300 mothers annually and care for them over, I'll call it a longer period of time in those vulnerable circumstances. Some of them have substance abuse issues or other challenges, but having a support group to help them evolve and orient to being a new mother. Also, we have our Seton Dental Clinic, which this is one of the things that I'm extremely proud of. Think about how vulnerable and fragile children are if they have what they consider to be a compromised smile. The confidence that may be lacking because of how you interact with others. We make a deliberate decision to provide that care throughout several school systems and make that available even on a mobile unit. That we go to communities, we go to schools and provide dental care free of charge, so that those students can have that foundation and that confidence to operate in our environment, which lasts a lifetime. We also have a very significant investment in behavioral health. The stigma associated with behavioral health issues is starting to lessen in our country, which is a good thing. But what we're learning is the need for services is growing. So how do we augment our services, the access points, to make sure that we can support people in that time of need? And I'll talk a little bit later about things that we're doing to make sure that we can do that for behavioral health and other services as well. One of the things I'm mostly proud of, what I share with my team on a regular basis, is that our tangible outcome, our clinical outcomes, our tangible product is clinical outcomes. I'm very pleased to say here today that over the last year, most recently announced that we have 6 hospitals that have been recognized in U.S. News and World Report for their clinical outcomes. Are we satisfied? We are not. But it's important and a line of demarcation, if you will, about the evidence of the work that's taking place in our hospitals. And if you happen to be a reluctant participant, hopefully it is with a confidence that we can care for you in that moment of need. We have a projection that later in the year we'll have more evidence, and what I refer to as third-party evidence or validation of the clinical outcomes associated with our care. Very proud of our team for that. What does the future of healthcare look like for Ascension, Wisconsin? I'll give it two components. When Karen introduced me, she talked about my history in terms of being a hospital administrator. My specialty, if you will, over time has been financial and cultural turnarounds. And so when I came to Wisconsin, it was with my eyes wide open about a very daunting task and challenge that we have and have had here with our facilities. I got a call one day, I was in Michigan, from a friend of mine. She says, I have a hospital in Milwaukee that I think you would be able to help. And because it was my friend, I said yes. I came to Milwaukee for the first time ever in my life, to Wisconsin for the first time ever in my life, on the 21st of March, 2023. And I went to Columbia St. Mary's Hospital. First, I went to Port Washington Road. Then I went to St. Mary's Hospital. And what I fell in love with was the mission of Ascension and the commitment to do good work. Secondarily, I fell in love with the people who were charged with doing this work and the responsibility in which we have been entrusted. And we started out to make the necessary changes, again, in alignment with our mission and values as an organization. How do we make sure this ministry is sustainable from a financial perspective, but also exhibits a culture that's indicative of the mission and values of Ascension as an organization? And I'm pleased to say that a year into this, actually my year will be August the 4th or August the 3rd, that we're making significant progress in that fashion. One of the things that I know will be a part of this change is that we will not be the healthcare system that we have been to this point. What does that mean? That means that it is important that we evolve the services and the access points based on data and the needs of the community that mirror that need. When I talked to you at the beginning about the 4 health systems that came together, in a lot of ways since that time in 2016, not much has changed. However, everything around us has changed in terms of the environment in which we operate. So how do we as an organization make the necessary changes, the tough changes, to mirror the services that we offer that meet the need of that community? And that is the work our team is doing today. difficult work, not without public scrutiny, not without a lot of thought and deliberate actions, but necessary for the sustainability and the availability of that care in those communities. And so what does that look like for us? It looks like a organization that is in the right place, offering the right care at the right time. And we're happy to do that work. We're going through a process of redesign, and you'll hear a lot of it in the newspapers about things that people may perceive as something that's going away. I assure you that is with a lot of thought, that is also with a plan, that we have the right services at the right place for the community in which those services are offered, and in a coordinated fashion across the healthcare needs of the city and the state. It is not with an eye to what others provide in the state as well. We probably have one of the best coordinated care, if you will, in terms of the healthcare systems here in the state of Wisconsin, collaborating and talking behind the scenes, which is a benefit to the citizens of the state. And so we'll continue that work. We'll continue to make sure we do the things that are right and putting patients at the center of everything that we do, every decision that we make, in an effort to demonstrate our commitment and our values to this community. With that, I'll stop and I'll open the floor for questions.
Thank you, Daniel. If you have a question for Daniel, you may form a line behind me. Use this microphone to ask a question.
Thank you for being here today. You and I each have a 14-year-old as our youngest child. And what would you say to young people today, including young people of color? My daughter, for example, is from China originally. What would you say to them? How would you encourage them to enter the healthcare field?
Excellent question. I'll start with my personal story, and then I'll extend from there. Very much as a child, my focus was on being a physician. It's what I read about, it's what I dreamed, but it was also in the realm of what I knew. It didn't go that route. I tell people that when I found out about the profession of being an administrator, I'm very blessed and fortunate because I do not consider it work. It was what I was meant to do. And so I appreciate that calling, if you will. What I share with people about healthcare and careers in healthcare, one, for the most part, they are recession-proof. What I also extend to people is the idea of you want to expose yourself to many aspects of healthcare. I talked earlier today about hospitals and healthcare is like a city. And so there's a number of professions that healthcare can hold. It doesn't have to be a clinician. And so I think that is a part that I would share with people and try to help them find whatever it is, your passion. Healthcare needs mathematicians. Healthcare needs architects. Healthcare needs scientists of all backgrounds. And so letting people know the breadth of things that healthcare can accommodate, then how do we find that match for your desires and what it looks like in healthcare? Yeah.
I would like to know about your turnover rates. And the reason why I'm bringing that up is I've heard complaints about not having enough nurses. And actually, I've experienced it myself. And so I'd like to have you address that. And also, are you having a lot of troubles with burnouts of your nurses?
Thank you very much. When I arrived in Wisconsin in March of 23, the overall turnover rate was about 47%. Nursing turnover was somewhere in the neighborhood of 62%. The most recent data I saw either late last week or today is Tuesday, so it must have been Monday, somewhere between last week and Monday. Our overall turnover rate, all jobs, 21%. Nursing turnover, 18%. That is not me. I talked about not only a financial turnaround, but a cultural turnaround. One of the things that's important for our associates to understand that they are valued, and this is in the context, do we have a nursing shortage? Yes, we do. There are lots of things that we do to try to minimize the impact that has. And so that is a daily conversation in our environment about how do we create a value proposition for people to want to be a part of our team. But once they choose to join our team, what do we do to retain them and create an environment that you want to be a part of for the long haul?
Thanks for your comments. Those statistics are really powerful. Two words kind of jumped out at me, your last slide about tailoring services. And you look at tailoring services not just to the community, but to the individual. It's very much like customized, personalized medicine or customized education. Do you have any thoughts on how the medical community, hospital community, public health community could connect with the education community to address some of the youth challenges we have that probably start as basic as low self-esteem and lack of empathy?
Right. From a public health perspective, I think it starts with a conversation and exposure. How do we create what I'll call formal relationships to cultivate those conversations? There are a multitude of ways to go about that. I happen to be from the perspective of communities of like-minded people aggregate together and they make decisions about what aspects or programs of how that community conducts itself. And so if we have a community that has put a prioritization on cultivating the relationships as you described, then we figure out how. You know, one of the things I use consistently, I call it to resolve problems. I'll ask the question, are you willing to join me in making sure we provide the very best care for the next patient? And over the course of my career, no one's ever told me no, right? And so once I get them to say yes, then my follow-up is, how are we going to do this together? And so I'm going to start and end with the collaborative conversation in a forum for a regular cadence of communication of what you want to accomplish, and then you get to align on the how.
Wow. You know, having consulted with a few of the healthcare institutions here, I know that community outreach is a real big issue for you, and I'd like to acknowledge you for bringing recognition with you today. This guy knows the community. My question, by the way, though, is precision medicine. I know that's not on the administrative side, but it has such an impact on patient-centered care. Can you speak to that a little bit?
I want to make sure I understood. You said decision?
Yeah, precision care. In other words,
Right.
we're not a monolith. So, you know,
Yes.
medicine reacts different with different cultures. And that conversation has emerged over the last at least 20 years that I'm familiar with, but is gaining a lot of momentum now. And I don't want to put you on the spot. I just want you to.
No, I don't take it that way at all. I think that's very real. One of the things that matters is representation, right? There's evidence-based medicine that says the healing process takes better when the patient is comfortable. Your comfortable may be based on the setting. Your comfort may be based on the provider. So when you have a provider that looks like you or understands your culture or understands who you are, that is a significant contributor to your healing process. And so if we know and understand that, I think it would be disingenuous not to take that into account. And that's for the entirety of the community. So I think there's value in the diversity of medical schools and different training programs so that we have a diaspora of participants in that realm so that we can meet the needs very specifically for members of the community. I believe that wholeheartedly.
All right,
Hello.
thank you. And it's such an honor to have you speaking here. Obviously, I work with you on the board of directors for Ascension. I'm a patient. My whole family goes to Ascension, and I think you've done amazing things, and the key word is culture. One thing you didn't talk about was the fact that Ascension is really part of this larger national network. And I think there are a lot of things that the local healthcare community can benefit from being a part of that national network, but there are also some challenges. Do you mind just touching on a few challenges and opportunities that you see working within the greater Ascension network?
Thank you, Tracy. I'll start with what I consider to be challenges. What Tracy is referring to, that we have a footprint of 140 hospitals across the nation. I think we're in 19 different cities. And so that's 19 states, sorry. 19 states. And so when you talk about the nuances of that, it can be difficult in terms of, I'll call it, being nimble enough to make quick decisions. That's a downside. Being who I am, I also understand that with experience, your understanding of how to navigate that more efficiently is a factor as well. But nonetheless, it is a part of that environment. Other challenges in that realm is people not understanding, and when I say people, I mean at multiple levels. It's not an uncommon thing. I go to Washington to talk to our senators and representatives, and they hear about what their constituents say and things they want, and may not understand the detail. So that can be a challenge of how do you bridge that divide about the details of what's happened. As a gentleman who talked about turnover. Not that it should be acceptable, but there are things that lead to that. Usually things that people don't want to talk about. We're not immune to what I'll call normal office dynamics. Typically high turnover relates to the boss. Are we going to talk about that? Yeah, there's a shortage, but if you have the right boss or the right manager, you probably can work through it better. Some of the things that are good about being a part of a large system: access to resources. I'm not speaking out of school. Over the last 3 years, our health system has not been in the black. But because of the association with a large organization, none of the philanthropic work stopped. None of the care stopped. We were able to financially weather that. Is it sustainable? No, it is not. But the value of having that backing your organizations matters. Other institutions would have probably folded. And so, again, we take that as the resources that we have been entrusted with, to be good stewards of those. To how do we create a feasible and sustainable platform? Does that help? Yeah.
Business model question. I once worked for a company that had a lot of nursing homes, and their reimbursement rate was even less than the one you just mentioned earlier. So what is the long-term solution? Because you lose money on many of the types of patients that walk in the door. I've got a friend that was in administration and talked about the different reimbursement methods, and there's a huge shortfall. So what is the long-term solution for us so that your system is not under such stress?
I think there are 3 components. The first is for the institution itself to operate at optimal operational efficiency, right? To be good stewards, to not have waste, to remove any type of waste from that system. 2 is to advocate with payors, whether it be commercial or the government, for a fair reimbursement rate for the work that's done. The third component is what I will call a informed consumer, that people understand their impact on the costs associated with their health and adopting healthy lifestyles to support those things. Those three things in unison, along with probably some other things, can help stabilize the environment.
I want to compliment your industry. You know, years ago, if you had an 11 o'clock appointment, if you got out of there by 12:30, you were lucky. Now, if you're 5 minutes late, the complaint guys have done a great job of getting us in and out. A couple of years ago, I went for an eye doctor test, and they sat me in front of a television screen, and I had to go back 3 different times till they finally got it right. But I'm told AI can do a better job of detecting your scans of your body than a live physician can. Where are we going with telemedicine?
It is in use in a lot of different ways. It is a bridge, but it is also at the same time uncharted territory. I'll offer it to you in I'll call it extreme manner. And I don't mean this to be negative, but just because we can make a 800 horsepower car doesn't mean we should start passing them out, right? I skew on the side of healthcare and the value of the human touch. There is value, lots of value in the diagnosis and treatment of individuals and prognosis that AI and other technologies benefit. I do not advocate for an environment where we lose the human touch.
Hi, thank you for coming. I was curious, what is the average number of hours you could expect if you have to go to the ER at an Ascension Wisconsin hospital? And a follow-up is, who or what organizations do you benchmark yourself against, and can you talk about that process?
So the average depends on a number of things. And so I don't have the specifics, but I can talk to you about factors. One factor is the day of the week. EDs are typically busiest on Mondays because people do what they want to do on their days off on the weekend, and they don't want to go to work on Monday, so they come to the hospital. The data proves it. So those are usually the longest wait days. Other things that depend on staffing, the weather. You can chart ED volume based off of paydays. There are a lot of factors that come into play. The desire is to have the EDs adequately staffed and beds available if the need for admission arises, that you see the patient in the most optimal way possible. The other thing that comes into play is that we have what we call non-urgent care. And so you have a proliferation of urgent care sites that would be alternatives for care that is not deemed urgent or emergent, I should say. Consider urgent but not emergent. I'm sorry. Benchmarking. We benchmark in 3 ways. Locally, across your provision of care, whether that be multiple counties or city, state level, then national benchmarks. And you do that based on, I'll call it the profile of said entity, because those factors come into play as well. And then the fourth one would be on the acuity of the patient. So how critical is their need at the moment they present?
Since you mentioned the ransomware attack that you had on one of your slides, I'm curious if there's anything, to the extent you can share, your learnings and your takeaways to help us who all face those risks every day. How did you resolve it? And is there anything, looking backwards, that you might have done differently to prevent it?
There's not a lot that I can talk about publicly, but I'll share in this regard. I think at the moment that we can tell the totality of the story, the response across Ascension will be considered world-class. Within 34 days, we had our systems back up in a reasonable amount of running. One of the contributing factors to that was early detection. Within about 4 hours of the primary incident, we had taken the necessary steps to mitigate the impact. And so that was tremendous. In a relative context, and I'm not telling someone's secret, if you're familiar with healthcare, there's a ransom or a cyber attack, if you will, on Change Healthcare, which is a significant player in the healthcare space. They're still in recovery. And that was 8 months ago.
Thank you, Daniel.
Mhm.